We know that hypertension is the most common cardiovascular condition responsible for the development and maintenance of atrial fibrillation. Now in JACC, researchers present another twist in our understanding of atrial fibrillation and how best to manage it. They studied patients with paroxysmal or persistent AF refractory to 2 drugs who also had drug-resistant hypertension. Now, the number of patients reported is small. 14 had pulmonary vein isolation, or PVI, and 13 had PVI plus transcatheter renal artery denervation. Patients were randomized to PVI only or PVI with renal artery denervation in a randomized fashion, and all patients were followed for 1 year to assess maintenance of sinus rhythm and to monitor changes in blood pressure. Here's a summary of the findings. 27 patients were enrolled, 14 were randomized to PVI only, and 13 had PVI with renal artery denervation. At the end of a year, perhaps not surprisingly, there were significant reductions in systolic and diastolic blood pressure in patients treated with PVI and renal denervation, without any significant change in the PVI-only group. But here's the interesting part. 9 of the 13 patients treated with PVI with renal denervation were free of atrial fibrillation at the 12-month follow-up post-ablation, versus only 4 of the 14 patients in the PVI-only group. So what does this imply? We're learning that renal artery denervation has effects far beyond hypertension control alone, and the effect on autonomic reflexes that are produces. We're learning that renal artery denervation has effects far beyond hypertension control alone, and the effect on autonomic reflexes that are produced by renal denervation now seem also to be able to help control atrial fibrillation. Clearly, more patients need to be studied with this combination therapy, but it certainly is intriguing data. I'm Peter Block, and this is a CardioSource Heart Minute.